Another edition of Three Plastic Surgeons and a Fourth. As always, I am Sam Jejurikar in Dallas, Texas, and I'm joined by Dr. Sam Rhee at Bergen Cosmetic, who is in Paramus, New Jersey, Dr. Sal Pacella at San Diego Plastic Surgeon from La Jolla, California, and Dr. Lawrence Tong, a.k.a. Larry Tong, who is at Yorkville Plastic Surgery. Damn it. In Toronto.
It's all good.
Which one is it?
Surgery.
Yorkville Plastic Surgery in Toronto, Canada. Welcome, gentlemen, as always. Today we have a scintillating topic to plastic surgeons, and that's compression garments and the broader issue of swelling after surgery. And I say that with some sarcasm in my voice because plastic surgeons talk about swelling all day long to patients and compression garments all day long, but it is an important topic for us to visit. So before we get into the meat of the topic, I'm going to throw it over to Dr. Pacella, who's going to read our normal disclaimer.
This show is not a substitute for professional medical advice, diagnosis, or treatment. The show is for informational purposes only. Treatment and results may vary based upon the circumstances, situation, and medical judgment after appropriate discussion. Always seek the advice of your surgeon or other qualified health provider with any questions that you may have regarding medical care. Never disregard professional medical advice or delay seeking advice because of something in the show.
Just remember, life is a game, so you have to play it.
Oh, that's a good strategy, Dr. Rhee. Throw that out there before one of us can quote it. Still going to quote it, though. So question for you guys. Can you guys name a solitary operation that you do that doesn't result in some degree of swelling?
Boy, no.
Wow. Fascinating question.
No.
Exactly. And is there been a single day where you have seen patients anytime in the last 10 years where you haven't had a conversation to patients about postoperative swelling?
Got me again. Man, jeez.
Yeah. I've often thought about years ago when I saw Celine Dion in concert in Las Vegas. She sang a duet with a hologram of herself. So it was a duet with Celine Dion singing a duet with Celine Dion. And I've often thought it would be great if I could actually have a hologram of myself talking about swelling that I could just play for patients and disappear and go somewhere else.
I don't know which is more disturbing, the idea of a hologram of you or a clone of yourself, or the idea that you went to see Celine Dion in concert.
I was about to say,
not once,
this.
Not so. Oh,
That's
totally
a great
thrown on
Canadian
topic.
you're talking about here.
But I've seen Celine Dion multiple times in concerts, and I probably do not know another heterosexual man that loves Celine Dion more than me.
Titanic.
And by the way, her triumph at the Olympics brought me to tears. So anyways, getting back to the topic. Okay, but all joking aside, all surgery results in swelling in compression garments.
Yeah. Sorry.
Wow, this went off the rails quick.
This tells you how interested surgeons are in talking about swelling. I mean, like innumerable number of times. She's an amazing vocalist, gentlemen.
Oh, yeah.
Like literally,
she's a real deal. Yes, I agree with
her
that.
command of the stage and the way she interacts with the crowd, you just want to be her best friend.
Mm-hmm.
So, okay, so compression guard.
Fascinating.
I'm gonna limit our topic to compression garments with body contouring surgery, because I think that'll kind of get us more streamlined where we need to be, because we have no ability to focus right now. So, a lot of times we'll do surgery on a patient and we put them in these relatively innocent looking compression garments, an abdominal binder or these body suits, and we put them in them right after surgery. Commonly, though, we see patients that come in after surgery and they're showing up in different compression garments than what we put them in. Do you guys have any problems when your patients do that? When your patients accelerate the compression regimen faster after surgery? What are the potential problems with that?
Yeah, absolutely. This is one of the biggest problems. And like you said, if I could just put a play tape recorder and just like recite everything that I know about swelling to every patient, that would save me years off my life. Every patient, especially doing liposuction or any kind of body contouring procedure, wants to know about their faja. Faja is Spanish for compression garment. And so it's always faja, 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 faja. And no matter what I put them in, you're right. I'll see them later. They got something 5 times tighter that they bought because someone else told them that this is what they needed, either on Facebook, one of their friends, whatever, their massage therapist. And the biggest thing that I see with really tight compression garments is when they're overly tight, they're actually making the swelling worse, which is a little surprising because they think, oh, the tighter it is, the less swelling you get. Well, when you're squeezing, for example, your arm, okay, guess what happens? Your hand will swell because you're not allowing the return of lymphatics, venous return to operate normally. And instead of actually making that swelling better, when you jam yourself into a ginormously tight compression garment or faja, you are oftentimes worsening the recovery that you have from that procedure, especially early.
I always thought faja was Dutch for father.
That's Faja.
Faja.
That's Faja.
Okay. Got it. All right.
There's one thing I tell patients to prepare them for the swelling. I say, you're here. There's nothing to fear. And I know that the swelling will go on. So we just got to continue.
I don't know how many of the viewers will actually pick up on the Celine Dion link to that, but that was good.
that brought a tear to my eye.
Fantastic.
I mean, there's a trite saying that surgeons have, though, that swelling happens in every case, and all swelling eventually goes away. And I think what Sam was talking about is there's this phenomena of garment trauma, where if you try to squeeze yourself into a compression garment that's too tight, too quickly, too many hooks, there have been numerous times that I have, and I know all of you guys have seen patients come in that have self-induced wounds from these garments. I've been texting back and forth with a patient today who's basically did this with a faja. So I generally do believe that compression garments are very important after body contouring surgery. I think they can actually have a big impact on the final results, but I think you have to be smart in the process that you go after it. Do you guys have any sort of guidance that you give your patients in terms of how they should think about compression, or how they should transition the compression garments, and how long they should wear them for?
I think I try to tell them that, compression garments are an investment in your recovery, right? Because, the post-operative massage can only do so much. So the garment is actually pretty critical, and you don't want to skimp on the garment, right? You got to stay into it. It's, this is the critical time for it. So I think if they sort of buy into the idea that it's an investment, they start to think about higher quality garments. Do you provide them for patients, Dr. J, or the rest of you guys, or how does that work for you?
Yeah, when somebody comes for surgery and they have a procedure that would typically use compression garments, that would be something that we would supply. I don't think it's ideal for patients that try to find their own. I mean, I guess if you have a supplier and you tell them, okay, go get it from this place, maybe that's a different story. But I just think it's easier and more streamlined if you just say, well, we're going to supply the garment, because they might not know the size that that they should be choosing either. So I think that in that situation, supplying the garment is probably the most straightforward and most efficient path forward.
Yeah, we supply them the initial garment that they use after surgery. They're more sort of an off-the-shelf thing that they can wear. These tend to have minimal hooks. They have compression, but not the tightest compression in general. They're more sort of geared towards helping to prevent seroma or fluid collections afterwards. They're not necessarily doing a great job for shaping. We've actually developed our own garments that patients can purchase from us starting around 3 or 4 weeks postoperatively that are a little bit tighter. Some of the, and then we have different garments that we've developed that for somewhere for around 6 to 8 weeks postoperatively as well. Those are ones that are much tighter, much more rigid material, much more hooks in them. Some of them are geared for daily wear, some of them are geared for going out. But I think at different stages, as patient swelling gets better, our general thought is the compression should get tighter, the material should get more rigid, and it can be more important for shaping afterwards.
I provide the first stage garment, and then I usually work with the patients after that. And I am along the lines of Sam. My general rule of thumb is if it hurts, if it's causing pain, if it's causing indents or other types of, major marks into the skin, that doesn't work for me. And I'll generally work with patients to increase the level of compression afterwards. The first ones are usually just for ease of use. So they usually have holes in the crotch, easier access, easier to put on and off. And then later, as Sam says, to get more rigid. It also depends on the season. Some patients will help them pick something different if it's July versus December in terms of comfort. But you got to find something that doesn't cause skin trauma. And as Sam says, I think more compression later is important. But at the beginning, overly tight can cause some major problems sometimes.
How long do you guys tell patients that they will have swelling after surgery? And how long do you encourage them to wear compression after surgery? Like for how many weeks or months?
If we're talking about body surgery, I try to tell them to wear it for about 6 weeks, knowing I'm only going to probably get 4 weeks out of them because, nobody wants to wear anything for 6 weeks. And then, I usually say, 3 to 6 months is kind of the turnaround time, I think. Of the dissipation of most swelling. If I've done a lot of fat transfer to the breast or fat transfer somewhere else in the body, I think it's a little bit longer, six months or so, For
me, it depends on the adjunctive treatments as well. If they're massage fanatics, if they're getting a lot of other non-invasive types of treatments, like it can go by. It's always months, but it could be 6 months, it could be 12 months. And it also depends on the level of degree of invasiveness of the surgery itself. I also have some patients that use their faja or their garments like security blankets. I mean, I have seen patients who are loath to give it up after 6 months, 12 months. And I don't have a outside timeline. I tell patients, if you feel comfortable wearing it for as long, like 12 months, go for it. I have no problem with it. I love if they can wear it for at least 6 weeks, as Sal says, minimum. I push hard for that, but I usually would love to have them in it for 3 to 6. And I know there's going to be some residual swelling depending on the individual and the type of surgery. So I'm sort of a longer term proponent rather than a shorter term proponent. But like Sal said, it's very patient dependent. Like they will only be as compliant as they're willing to be. So I try to advocate, but I know that they will probably make up their own mind.
I think, the duration of the swelling is, in my experience, somewhere in that 4 to 6 month range for sort of if you're doing liposuction kind of thing. I think it's important for patients to know that the swelling resolution is not linear. There's a lot more swelling that goes away in the first couple of months, and then it really slows down. And so I usually tell patients that, they look pretty decent at about 4 to 6 weeks after surgery in terms of swelling, but there still is a fair amount of swelling that will still go down as time goes on. And 4 to 6 months is an average, but it depends on the patient, depends on the area, depends on the surgery that you've had. So it could be much longer than that. For how long I have them wear it, I'm sort of like Sal. I don't think that patients are very compliant in wearing these things. So I usually tell them to wear it 24/7 for the first 3 weeks after surgery. And then I just have them switch it over to just another 3 weeks, but just at night when they go to bed. And maybe that's not the optimal, to shape and because I don't do progressive
tension sutures,
progressively tighter. I don't do progressively tighter garments. Afterwards, I'm not 100% convinced that that makes a big difference. So usually it's just the same garment, wear it for the first 6 weeks, 24/7 the first 3 weeks, and then just half the time the following 3 weeks, and then they're done.
That's interesting because my protocol is a little different. I'll tell people, first of all, you got to change the way you think about swelling. Patients obsess and worry about swelling, and they think that something is going wrong when they have swelling. As every doctor knows, swelling is a natural part of the healing process. The more we do to your body, the more swelling there is. The more aggressive the operation, the more the swelling tends to be. I use a lot of energy devices with liposuction, whether it's BodyTite, whether it's phaser. Pretty much all of my cases have some component of that. And I do think that prolongs the postoperative swelling. So I tell them, and I'm a big believer in lymphatic massage as well. I do think it helps my results quite a bit. So I want them to get lymphatic massage. I think particularly in the first 6 weeks, that can be helpful. I want them to wear their garments 24/7 for 6 weeks. I tell them for the next 6 weeks after that, I want them to wear it at least 16 to 18 hours out of the day, and we transition them to more flattering garments. And then even after that time, when they're past 3 months, I want them to wear it, 10 to 12 hours. And I tell them at that point, I don't think it changes their final results if they're wearing it all the time, but they had liposuction for a reason. We're not people that like delayed gratification. Like, people are not generally okay with me telling them you could look better. So I'll tell them, wear your compression during the daytime, Monday through Friday, when you're home on the weekend, so that when you go out, when you're trying to look your best, you look your absolute best. You look the way you're going to look when your swelling is gone. When you wear your compression, it should not be comfortable. You should be cursing my name when you put it on. It should be really, really tight. But then that way, when you're out there and you're, at the pool, or you're out on Friday or Saturday night, people look at you and they think, damn, like, she looks incredible.
That's an important point. I mean, like, if you stop wearing the compression garment early, the swelling's going to come back, right? Just like Celine says, it's all coming back. It's coming back to reality.
It's coming back to me now. Come on, man. Oh, it was going so well too.
I think Pacella has. I think Pacella has stiff man syndrome for Celine Dion.
just oh boy. Notice how you changed stiff person syndrome back to stiff man syndrome just for that reference.
Oh boy. My mistake.
Right.
Stiff person.
Exactly. I don't know where to go from this.
Do you have particular models, or you designed your own? So tell me about that, Sam. How are you designing your own Faja?
So
he's a man of many talents.
I know.
So it was done with help, obviously, and it's sold through our skincare center, Epicenter. It's a relatively new development in our practice, but it was with the help. It's from some Colombians that have basically helped us with this,
right?
Where they kind of knew the general shape of our patients in Dallas. They helped design garments with appropriate waist to hip ratios. As we got sort of further out, the material got more rigid, and then there's some practical issues that go along with it. One of the biggest complaints people have with their compression garments is going to the bathroom. So there needs to be an appropriate zipper-like component to it, so that you can unzip it and you can go number 1 or number 2 and go to the bathroom pretty easily. They can go in the freezer, so they're cool when they go on. We tell our garments patients to get 2 of them, and it's pretty freaking hot right now in Texas right now. So being able to put on a garment that's a little bit colder when you put it on is helpful for people. And then particularly the ones that are for greater than 6 weeks, there's ones that are easy to wear during the week, and then there's ones that are more appropriate if you're wearing like a dress or you're going out, so that they don't go quite as high. And that way, even when you're going out, you look like you had this surgery. Because again, we live in an age of Instagram filters where people change the way they look and the way they present to the outside world. We're not in a world where people are, at least my patients, are okay being swollen when they go out. So there's a lot of thought that went into them.
You Dallas guys have this vertical integration thing taken to the nth level. We're going to be like living in DPS's world for everything. This is very impressive, Sam. Very nice.
putting stuff in the freezer to wear is not a problem in my part of the world.
Fair enough. Fair enough. Maybe right now, isn't it kind of warm there right now?
Yes, it's warm.
Yeah.
You know, we've got our 8 weeks.
There you go.
Humid.
Enjoy it while it lasts.
Gets humid up there.
Thank
too.
you.
I'm from that part of the world.
Well, hopefully patients found this podcast instructive. It is not a topic that surgeons love talking about swelling, but it is an important part of the recovery process. Any last thoughts, gentlemen?
Take it away.
Follow your,
Pacella.
I think. While he's thinking his next Celine Dion reference here, I just want to say, it's funny how much patients obsess over garments and how little surgeons want to talk about it. But that's where we decided it is important for us to share our knowledge to make sure that you understand every surgeon is different. The types of surgery they do, the Faja or the pressure garments that they use, they're customized for what their practice is. Like how I operate is probably different than Sal or Larry or Sam. So what I do with my recovery is slightly tailored differently. You know, we can't, dude, that's copyrighted. We can't put that
Copyrighted material, man.
Dude, you're going to get us, it's not.
Great. You're going to have Celine coming after us. And that'll break my heart, man.
She's going to sue us, dude. Her and her husband, Rhee, or maybe
No,
he's
they're
dead.
divorced.
I don't remember.
Are they divorced? I thought they were divorced.
No, he died many years ago, guys. Come on, it was tragic. He had cancer. It was one of the great. You guys need to watch the movie. You guys need to watch the movie on Amazon. I Am Celine Dion, and I challenge you not to shed at least one tear. It's a beautiful story of what she's going through right now.
Okay.
How many times have you seen it?
It's on my list. It's on my list.
It's so good. It's so good. It's a heart-rending story.
All right, I just saw Deadpool Wolverine. That'll be the next one now.
Yeah, it's either that or The Boys when I went on Prime. So
tough choice.
wasn't really a hard decision.
You know, guys, you guys can live the male stereotype. Don't be afraid to have some feelings, guys. It's okay. All right. Well, I'm not sure that was our best podcast, but I'm definitely entertained. So on that note, gentlemen, have a great rest of the day.